I love acronyms like OMG, I shouldn't say WTF, but no, I've got Dr. Michelle Roughton here from Bustmob,
MR,
who's going to be very professional, MR, to talk about ALCL, because we hear it, we see it sometimes. I really don't have a clue what it means and if it's something I should worry about.
Well, we're all learning about it, honestly. It's only been in the last 10 or so years that it's been a thing, and it's even more letters. It's BIAALCL.
Oh. Okay.
Breast Implant-Associated ALCL,
Okay.
Anaplastic Large Cell Lymphoma. Because in fact, there's Anaplastic Large Cell Lymphoma that's not associated with breast implants.
Okay.
Those are separate disease processes, and I don't pretend to be an oncologist. What I do know is that the risk is between 1 in 2,000 and 1 in 40,000. So that doesn't narrow it down too much for you. It's, as of today, only ever been found in a patient who has had a textured breast implant. There are a few scattered deaths, and they were early on, so it can be lethal. For the most part, now that we know what we're looking for late onset seroma, so a fluid collection around your textured breast implant that presents usually 5 to 8 years later. It can present earlier, not in the first 6 weeks. So a fluid collection, and then we would sample that fluid and find some abnormal cells in it. The treatment is then to take out the implant and that capsule, the scar around the implant. And you can even put in a smooth implant that's at that same surgery. So you wouldn't even necessarily have to be without your implant. Typically does involve a surgical oncologist, a dual case, to make sure that you're getting kind of standard of care treatment, because it is in fact so rare. Not every plastic surgeon has seen a case. Thankfully, I haven't seen one myself. But again, I think if you've only ever had a smooth surface breast implant, I would kind of put that on the back burner as something not to stay awake at night worrying about, because it's never been seen in that patient population. The reason we have such a hard time getting a number for you is that, unfortunately, we know how many cases have been verified in the world, but what we don't know is the denominator. We don't know how many textured breast implants there are in the world. And so that can be tricky. Different implant manufacturers also have different risk based on the fact that the surface of the implant is different. And it was like a proprietary thing for each company. So that's been, as we're learning more and more about it, we can kind of calculate your risks to be a little different depending upon what surface your body has seen. Now, does that mean I would never use a textured breast implant? Well, no, I still use textured breast implants, but only in patients for whom that's a highly selected decision. So oftentimes that's a patient that's had capsular contracture or is at high risk for capsular contracture, because textured breast implants reduce the risk of capsular contracture.
Got it. And I'm sure if someone is worried or has additional questions about it, you'd recommend talking to their surgeon.
Absolutely.
And making sure that they feel comfortable with it.
Absolutely true.
Awesome. Thank you.
If you're researching plastic surgery, you're going to want to hear this.
The video you just watched was one of hundreds of educational plastic surgery videos that you can find in the completely free Bustmob Academy app. Go download it in the App Store.
That's right. And that's not the only free resource. We have tons of them that the team at Amelia Aesthetics has built with you in mind.
Yep, so you ready to start researching? Watch this video right here to learn about all of the benefits and resources available to you in the Bustmob community.